Good morning, ladies and gentlemen. May we request everyone to please all rise for the invocation and the singing of the Philippine National Anthem.
O Almighty and Eternal God, we come before you with humble hearts, seeking a united spirit. Direct our paths with the boundless wisdom of your greatness, and open our spiritual eyes and ears to see and hear your truth. Grant us the grace to understand ourselves and the times we live in, and strengthen us not to pursue only what we desire, but to fulfill the duties you call us to with unwavering faith. Help us, O Lord, to see the goodness in others, to honor the individuality you have placed in each person, and to practice tolerance, expecting no more of others than we are willing to give ourselves. Preside over our deliberations, O Lord, and grant us the wisdom to choose rightly, the courage to act justly, and the steadfastness to carry out your will. In all things, may we be guided by your light and love. Amen.
Bayang magiliw, perlas ng silanganan, alab ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiting, sa manlulupig, di ka pasisiil, sa dagat at bundok, sa simoy at sa langit mong pughaw. May dilag ang tula at awit sa paglayang minamahal, ang kislap ng watawat mo'y tagumpay na nagniningning. Ang bituin at araw niya kailan pa may di magdidilim. Lupa ng araw ng luwalhati pagsinta ko'y langit sa piling mo. Aming ligaya ng pag may mga api, ang mamatay lang dahil sa'yo.
Seated.
Good morning, UST! Wala ako. Hello, good morning, UST! Let's do it one more time. Let's go, Tigers! All right. My name is Jackie Go, and it is such an honor to be your host for the second edition of the Manila Bulletin Sustainability Focus Session. Now, for those of you who have heard this the first time, this is a meaningful gathering of experts, champions, and future leaders, which is you guys, to share, brought together by a shared commitment to sustainability. Now, this event is proudly brought to you by Manila Bulletin. The inaugural session, which was also held right here at University of Santo Tomas, focused on the power and real estate sector. Now today, we will take it a step further as we shine the spotlight on a sector that touches every Filipino life. Can you guys guess what it is? Ay, silence. It's healthcare. Right, you saw the video a while ago now. Together, we'll explore the challenges, the breakthroughs, and the bold initiatives shaping a more sustainable healthcare system in the Philippines. Now, we are privileged to be joined by some of the country's most respected professionals from both the public and private sectors today. We are also grateful as well that you, our future leaders, are here to join the discussion. Now, we will make sure that you will gain a lot of insights and also take home exciting prizes courtesy of our featured brand partners through our raffle draws, which will happen at the end of the morning and the afternoon sessions. Now, to join, simply answer the survey forms by scanning the QR codes. If you can see it, it's posted literally on the walls of the venue. Now, UST, are you ready? Ay, parang Did you guys have breakfast? There's no energy. I'm gonna share my energy with all of you guys. Once again, UST, are you ready? All right, let's dive in and begin envisioning the future of healthcare. Now, to open this year's discussion, we will hear a special video message from Department of Health Secretary Teodoro Ted Herbosa, who's been pushing for healthcare reforms that champion a more humanistic approach to the Universal Healthcare Act to have better compensation and stronger rights for healthcare workers. Everyone, kindly direct your attention to the screen.
To Manila Bulletin Board of Directors, management team, and executive officers, led by the chairman, Mr. Basilio C. Yap, esteemed guests from the University of Santo Tomas, health partners, ladies and gentlemen, a pleasant morning to all of you. First, allow me to express my warm congratulations to the Manila Bulletin for this remarkable 125th year. Since its establishment on February 2, 1900, the Manila Bulletin has not only documented our country's story, but has also stood with us through every chapter of our nation's public health journey. Sa ngalan ng kagawaran ng kalusugan, taus-puso po kaming nagpapasalamat sa inyong suporta at malasakit sa kalusugan ng bawat Pilipino. Today's theme, envisioning the future of universal health care, proper nutrition, and equitable access to medicine, could not be more timely or meaningful. It echoes the very heart of what we in the Department of Health fight for every single day. A Philippines where health is not a privilege for a few, but a promise for all. Our journey towards universal health care is built on decades of hard work. The Philippine health system stood as a model for others to emulate. With the inauguration of the Commonwealth of the Philippines, the Bureau of Health was established, led by Dr. Jose F. Fabella. By the 1940s, the Bureau had evolved into the Department of Health and Public Welfare, prioritizing tuberculosis, malnutrition, malaria, leprosy, gastrointestinal infections, and high infant mortality rates. Fast forward to 2019, when the Universal Healthcare Law was finally signed into reality, it marked a historic shift. Healthcare was no longer just a hope. It became a right. No Filipino should ever have to choose between life-saving care and financial ruin. Bawat Pilipino, mula sa pinakaliblib na barangay hanggang sa pinakaabalang lungsod, may karapatan sa abot-kaya, dekalidad at maaasahang serbisyong pangkalusugan. Of course, making vision a reality is not easy. Today, we still face malnutrition, vaccine-preventable diseases, maternal and child deaths, and the growing burden of non-communicable diseases like diabetes and heart disease. We also grapple with ensuring timely access to life-saving medicines, especially for our poorest and most vulnerable kababayan. Our health system requires strengthening to bridge significant gaps, particularly in achieving adequate ratios of beds, nurses, and midwives to patients across provinces. To tackle these challenges, the Department of Health introduced Administrative Order Number 2023-0015, outlining a medium-term strategy known as the 8-Point Action Agenda sa Bagong Pilipinas, Bawat Buhay, Mahalaga. This strategy builds on past reforms and responds to the President's and this administration's priorities. The strategic map envisions policy alignment and collaboration among stakeholders nationwide, aiming for the Philippines to rank among the healthiest nations in Asia by 2040. The UHC Act emphasizes the crucial role of primary care, which it defines as the initial contact, accessible, continuous, comprehensive, and coordinated care that includes a range of services for all presenting conditions. The Department of Health will implement primary care through 3 pillars: health promotion and disease prevention as the first pillar, acute care as the second pillar, and women's health as the third pillar. Further, to address gaps in the delivery of primary care services, the Department of Health rolled several service delivery platforms that will supplement the primary care services provided by the local government units and private clinics, utilizing the current capacities of the Department of Health to ensure the continuum of care. Bagong urgent care and ambulatory services or bukas centers to address the gap in acute and ambulatory care services, bypassing the current health behavior of directly seeking care in a tertiary or inpatient care centers. Purok Kalusugan. This will translate health interventions into grassroots actions within communities, leveraging the Purok structure for effective service delivery and monitoring. Our endeavors aim to achieve the following 8 primary care outcomes. Immunization, to achieve 95% fully immunized children, raised from 72%. Nutrition, first 1,000 days, decreasing stunting to 13.5% from a high of 27. Maternal health, decrease maternal deaths to less than 111 per 100,000 live births from a high of 154 per 100,000 live births. Water, sanitation, and hygiene, increase the percentage of population with access to safe drinking water from 88% to 100%. Tuberculosis, 0 TB case mortality rate from 34 per 100,000 population. Road safety, decreased death rates attributed to road injuries to 4 from 8 per 100,000 population. Non-communicable diseases, specifically hypertension, diabetes, and mental health. Increase hypertension and diabetes control by 50%. Specifically, cancer, increasing screening, diagnosis, and treatment of cancer by 50%, and cross-cutting all 8, the digitalization of health services. These are not just targets, these are promises to mothers, to children, to families in every corner of our country. Nutrition and access to medicine play a critical role across all these outcomes. A well-nourished child is a child who can dream and build a future. A pregnant mother with access to safe medicines is a mother who can watch her children grow. An elderly Filipino who receives proper treatment for hypertension is an elder who can continue sharing wisdom with generations to come. In building the future, we know we cannot work alone. We need your voices, your platforms, your networks. We need your strong commitment of partners like Manila Bulletin, who for 125 years have understood that information saves lives. We need the support of communities, the bravery of our frontliners, the leadership of our local governments, and the innovations of our partners in the private sector. As we move forward into a new era, let us reimagine healthcare, not as a privilege, but as a foundation of our national identity. Let us make proper nutrition and access to essential medicines not dreams, but realities. Let us ensure that when we talk about universal health care, we mean health care that truly reaches the farthest purok, the poorest family, and the most vulnerable Filipinos. Once again, thank you to Manila Bulletin for over 125 years of service to the nation. Mabuhay po kayo at mabuhay ang isang malusog at makatarungang Pilipinas. Dahil sa bagong Pilipinas, bawat buhay mahalaga.
All right. Thank you so much, Secretary Herbosa, for your message and your time. Now, we are honored to welcome the Department of Health Assistant Secretary Albert Domingo. Drawing from his extensive background in public health and education, ASEC will share his insights and vision for a healthier and more informed nation. Please join me in giving a warm round of applause to ASEC Albert Domingo.
Thank you so much, Jackie. Hindi ko kaya yung energy ni Jackie. Ang aga-aga pa. Good morning, UST! One more time. Good morning, UST! How many here are medical students? Raise your hand. Aba, bakit wala yung mga medical students? How many here are nursing students? Pharmacy? Wait lang. So students of what fields are you? Can you shout out what your courses are? From that side over to the left? Medtech? Medtech, sa front, pero yung likod, parang may paralysis yung head, hindi nagnanod. What's your course? I'm looking at you, at the one at the back. Oh, see, iba yung course. Bio, Medtech, Bio. This over here. Nutrition and? Malnutrition. Nutrition and? Bakit parang kinahihiyan niyo yung course niyo? What's your course? Sorry? What's the course? It's either hindi niya masabi, mahaba siya, or can someone shout it out clearly? What's the course? Nutrition and dietetics. All right, over here. Very nutritious pala itong center part na to. All right, and then over here. Akala ko physical education kasi naka-shorts sila. Hospitality man, biglang gumaling sa harapan. So good morning. Thank you for inviting the Department of Health here. To Mr. Basilio Yap, the chairman of the Manila Bulletin Publishing Corporation. The board of directors, Ms. Irish Lorenzo, head of Manila Bulletin's branded content group. Mr. Ray Ilagan, editor of the Manila Bulletin Sustainability Section, Mr. Philip Kuunjeng, the project lead of the Manila Bulletin Sustainability Focus Session, and to Reverend Father Louis Coronel, OP, EHL, the Secretary General of the University of Santo Tomas, and all the students who are here and all of the faculty are also here. Magandang umaga po sa inyong lahat. I will not repeat the lecture that Secretary Herbosa gave. Rather, I will aim to supplement what the Secretary said. This is a forum on sustainable development with focus session on health and nutrition. How many SDGs are there? Very good. Kala ko silent. 17 SDGs. How many SDGs are for health? Trick question. How many SDGs are for health? Oh, what is the SDG for health? SDG number? Very good. But the trick question as to how many SDGs are for health, actually all the 17 SDGs are linked to health. There is an infographic that has health, which is good health and well-being, SDG 3, at the center. That's at least how we would like to believe it in the health sector. And when we say that SDGs, all 17 of them are linked to health, we have to also learn, understand the context. Bakit ba natin kinoconnect yan? In the Philippines, we keep on talking about universal healthcare. I was watching the snippets, the clips of the students speaking at the start of the program, and a lot were speaking about universal healthcare, social justice, and they're right, because in our Philippine Constitution, do you know that in the Constitution there is universal healthcare? It's not written as UHC, but the wordings are as follows. Article 2, Section 15 of the 1987 Philippine Constitution, the state shall protect and promote the right to health of the people and instill health consciousness among them. But if you go to Article 13, Section 11, the state shall adopt an integrated and comprehensive approach to health development, which shall endeavor to make essential goods, health, and other social services available to all the people at affordable cost. What does that sound like if not universal healthcare? Ibibigay mo ang mga serbisyo at mga produktong pangkalusugan sa lahat ng mga mamamayan sa presyo na abot kaya, kung pwede nga libre. The provision continues and says, there shall be priority for the needs of the underprivileged, sick, elderly, disabled, women, and children. The state shall endeavor to provide free medical care to paupers. The state shall endeavor to provide free medical care to paupers. That is very important kasi people think, a lot of us think, that UHC is a 2019 law. It's been around since 1987, probably even before that. There have been so many attempts to reform the Philippine health system. Do you know why we call rural health units rural health units? There is actually a 1954 law that identifies them as such. And it continues later on. When was PhilHealth founded? Do you know what year? Parang quiz B. What year was PhilHealth chartered? Anyone? That's okay. Probably a lot of you were not yet born at the time. 1995. But that is not the start of PhilHealth. It actually used to be the Medicare Commission in 1969. Marami pa yan. Sunod-sunod yung mga batas. But probably, you have also heard of the local government code. Do you have classes in health development or in public health? You do. Do your professors talk to you about devolution of healthcare? Wow, I see a lot of vigorous heads nodding, and that's good. And is it seen as positive or negative? Do your profs say that devolution is good or devolution is... How many think that devolution is good? Raise your hand. How many think that devolution is bad? Raise your hand. How many are shy and do not want to raise your hand? Keep your hands down. No, devolution has mixed reviews. I'm mentioning this because later, as you will probably hear in the panel discussions, and as the Secretary said, we've been trying to fix it for so many decades. A lot of you are probably here, let me ask you, how many here want to go, kasi walang nursing student, walang medical student, how many here wants to go into the medical profession after your undergrad? Raise your hand. Be honest. Oh, meron naman. Dito, meron? Meron rin. Dito, meron? Wag na kayong tumuloy. No, that's okay. Tingin nyo maganda ginagawa namin sa medicine. Tingin nyo masarap ang buhay. No, kidding. You have to understand that before you go into the healthcare profession, before you become a doctor, before you become a nurse, before you become a medical technologist, we all work within a system. When your prof talks to you about devolution, whether it's good or it's bad, it has a lot of effects. And having said that, primary healthcare has always been the puzzle that devolution either is trying to solve or is trying to prevent. When I say prevent, bakit? Ang daming pinag-uusapan ngayon, when you listen to discussions on universal healthcare with the private sector, I understand there will be other brands later, commercial brands who will be talking about access, talking about medicines. Tanungin niyo sila, happy ba sila sa universal healthcare law? Happy ba sila sa system natin for devolution? Those will be good discussion points. And the DOH has been trying to fix that problem, plus the issue of delivering services at scale. When we say delivering services at scale, a medical mission, a small one, is good for the people who are in that medical mission. But imagine the work of the Department of Health. We're trying to run a medical mission that has around 114 million patients, and the medical mission does not stop. It keeps on going on. Because every day, there is always a health issue. Every single week, there is something to prevent. Every single month, there might be a new health crisis or something. After I speak here, there might be a news alert from Manila Bulletin or other news organizations saying that there is another discovered virus or another disease or something, or a car unfortunately rammed into a standing sa Vancouver, Canada. So there are so many health events happening all the time. Medical missions in small areas do not cut it. We have to deliver services at scale. Siguro, I'll wrap up na lang what I'm trying to say by greeting one of our partners, very important when it comes to trying to scale these services, trying to inform our population of what the DOH is doing. And obviously, that's the Manila Bulletin, alongside the many other traditional media. And when I say traditional, I'm not saying it in the traditional sense that, ay nako, luma na yan. No. We are in an age where the information sphere is very dynamic. As the department spokesperson, I check on many things. I still have a paper broadsheet. Meron pa rin akong dyaryo, nagpaparasyon pa rin ako ng dyaryo sa bahay. But at the same time, my phone is almost always on because we are monitoring social media. The DOH Facebook page, make sure it's the verified one that you're looking at, has 8.3 million followers, steady, hindi na siya bumaba. The largest social media page in terms of followers, government social media page. We also listen to the radio, the TV, but there are also many other sources of information that we cannot keep track of. Daming fake news. Nadi-deepfake na nga, nag-iiba na yung ano, di ba? So, we have to also greet the Manila Bulletin in that regard for being still here, 125 years, no? That was 1900 all the way to today. And for those of you who are from the Manila Bulletin, my last few words na lang, the Manila Bulletin is actually part of my personal life. Growing up, when I was a kid in the 90s, ang Manila Bulletin, hindi yung nipis ngayon. Actually, all broadsheets manipis na ngayon eh. Dati, ang broadsheet makapal. And do you know what the bulk is? Classified ads. Why do I say this? Growing up, my mom was a real estate broker. Tumitingin niya ng mga listings sa classified ads. So, the newspaper we always had at the time in the 90s was the Manila Bulletin. There was no Facebook. There were a lot of brownouts in the 90s who were having TV and radio. Information is very important. So now looking at the, shall I say, the next generation, the future generation of doctors and healthcare practitioners, please keep studying hard. Make sure your motivations are correct. And as you go through this day's forum, when it comes to healthcare, keep the question in mind. Is this really what I want to do for a lifetime? Lalim. So maraming salamat po sa lahat and have a good morning.
All right, thank you so much, ASEC Domingo, for taking time to join us today. But sir, please, can I call you back on stage for a quick photo op? Yes, and joining ASEP, may I call on stage our Manila Bulletin executives, Head of Branded Content Group, Ms. Irish Lorenzo, Manila Bulletin Sustainability Focus Session Project Lead, Mr. Philip Kuunhing, and Editor of Environment and Sustainability Section, Mr. Ray Ilagan. All right. Hello, good morning, mga sir and ma'am. Okay, everyone who wants to take a photo, you may now proceed. All right, thank you all. Everyone, please take your seats. A big thank you once again, ASEC Albert Domingo. Grabe yung final words ni Sir, parang pati ako napaisip. All right, now let's hear some words from one whose passion and the reason behind why this is happening and dedication have been instrumental in bringing this platform to life. Ladies and gentlemen, please welcome Mr. Philip Kuunhing.
Hello, good morning, everyone. To all the students here, I just wanted to thank again ASEC Domingo. If ASEC Domingo actually remembers, first time I met him was during the Magsaysay Awardees ceremony. And it's actually one of the things that spurred us to actually create this forum, no? Because if Mr. ASEC Domingo remembers, it was during the Magsaysay Awardees that I was struck by the information that in Thailand, they've had the Universal Health Act since 2002. And as of last year, the average Thai citizens spends about 9% of out-of-pocket expenses for all his medical expenditures. So that's 9% for the average Thai citizen. In 2023, for the Filipino citizen, he spent an average of 44% out-of-pocket. So you can see the big disparity between 9% and 44%. So it's a big challenge that the DOH is facing. We've had the law since 2019, but as ASEC Domingo was also mentioning, even the United Nations World Health Organization thinks in terms of best case scenario for the Universal Health Act here in the Philippines to be truly effective, it would be like at the earliest 2030. And so those are the facts that we have to face, no? And so I think that's why also he was telling you guys to really be sure of what you want to do, because what you have is really a challenging proposition in terms of bringing universal health care into a reality here in the Philippines. And that's why precisely we brought this forum together, because we try to bring in together, besides the national organizations such as the Department of Health, we've also tried to bring in some of the companies who are actually at the forefront of trying to make this a reality and trying to fast track this 2030 target. And so for a lot of you people here, these are the companies that you will be interacting with in your futures. Whether it's an HMO, whether it's a medical center, whether it's a drugstore, whether it's a pharmaceutical company, these are the companies that you will actually be maybe applying to work for. These are the companies you'll be interacting with in the course of your careers. So we're hoping that you'll take this big opportunity as a chance to be able to assess and maybe analyze for yourselves which are these companies you'd actually like to be working for, and what kind of sustainability message do they imbibe or make part of their corporate DNA in terms of moving forward and making that universal health not just a dream, not just a law that exists, but a reality for all the citizens of the Filipinos, no? And so we want to thank UST. UST has been a great partner for us in terms of our first focus session last September. And as you saw, I'd like to give a hand also to the students who were kind enough to join us when the social media team of the Manila Bulletin came around to ask questions about sustainability and what their reactions would be. So I'm hoping you guys will take this opportunity to really understand what it is your careers will entail, what your careers will amount to, and it doesn't matter whether it's from tourism for medical tourism, whether it's medical tech or nutrition or the pharmacy or actual medicine as a doctor or nurse. It's part of us hoping to inspire, to empower you people in terms of what it is that your careers will shape out to be in the future. So I thank you again. I don't want to be talking too long because I'm not the expert. The experts are the ones who will be coming on the stage, but us. On behalf of the Bulletin, we'd just like to be thanking you guys for attending this session. Thank you.
All right, thank you, Philip. Now, before we introduce our next speaker, again, a quick reminder to everyone to please answer the survey form. Now, this will serve as your ticket to our raffle draws happening at the end of the morning and the afternoon session. Simply scan the QR codes, literal, ayan siya guys, sa wall, and that's it. Winners will be announced throughout the day's program, so be sure to stay kasi pag in-announce kayo, baka mamaya, pag nabunod kayo, hindi pala pwede pag hindi present. All right, now that we've gained some insights and into the efforts and the plans of the public sector, it's now time to hear from the private side. Starting with Ayala Group's AC Health, a brand that's making bold moves towards sustainability. And their mission? To make healthcare accessible, affordable, and high quality for every Filipino. Today, let's hear their perspectives on shaping career paths with sustainability at the core. We are joined by a respected leader in his field. Get this, he is the first Filipino clinical researcher to pass a USD FDA audit and the only Filipino to have served as president of the Asia Pacific Association for the Study of the Liver. Wow, that is a handful. Let's all welcome the medical director of Healthway Cancer Care Hospital, Dr. Jose Joey Soliano. Good morning, sir. Welcome.
Good morning. Thank you very much for this invitation, Manila Bulletin. I'm very happy to share my insights to, hopefully, to the students' perspective. And I titled my talk, Shaping Our Career Paths, Your Career Paths Towards Sustainability as You Shape Your Future Today. Basically, I'm a professor of medicine at the College of Medicine at this campus, and I've been roaming around this campus since 1969. So I am very, very much gold and black. All right. So when I was asked to give this talk, I consulted Copilot, the ChatGPT of Microsoft, to make it easier. And he gave me 4 of these 8 things that I want to speak about to you today. And therefore, I added my personal perspectives, and I hope that I'm speaking to the students, maybe not for these people in front, but for the people who have still black hair. And let us see how we are as a student who is dreaming to be one of the most important people in this country and, of course, in the world. And therefore, when you are going for the people who are wanting to go to medicine or maybe to nutrition, this is all the same. Whether we want to be a teacher or an investigator or a clinician or a scientist, we all want to be what we are, and that is what we want to advise people. Begin with a purpose by what you think you will be better and be contributory to the growth of your families, your society, and of course the country. Because we know that when you have a passion that you have dreamt about and have committed to yourself, then clearly success is just around the corner. This adage that says, allow your passion to become your purpose, and so that will become your profession in the future, is very important. And I think today we talk about sustainability, we talk about sustainability in our families, in the workplace, and of course, in the environment. Always that when you dream, you want to be bigger. We don't want to be smaller. And make sure that you are wanting to be a professional, wanting to be a leader in the big stage. The problem with education in this country is that when our parents tell us, or tell all of us, to go to universities, mag-aaral kang mabuti para magkakatrabaho ka ng maganda. To me, that is a very defeatist attitude. Kasi tayo nag-aaral para mag-imbento, gumawa ng sarili nating hanap buhay, at para tayo ang nagtatanggap ng mga aplikante. Because we are not here to study to become an employee. And hopefully that is a challenge that everyone will be coming home after this talk. And I don't want to belabor the fact that we need to commit to a lifelong learning, all of us. Being a student, being a professional, and being a parent, we all learn every day. But I want to focus on what is the mantra today: research, innovation, and I equalize that and I put that as an equation into versatility. We know that when you do research, when you do innovation, you basically are the leader. And when you are tracking and wanting to create a career, we want always to be one that will be in charge of our life, our destiny. But it is important that you envision your future and you endeavor and work hard to create that future. And of course, creating the future is to be able to stay current. When I was a medical student, I wanted to be a surgeon, but I realized that during my time, I graduated in 77, I thought that, endoscopy was very good because it can access the abdomen, it can access any part of the body that's an orifice, and you can do something there. You don't need to be operated mihiwa. So I did endoscopy, and I thought that endoscopy gave my life, created my career, and now I'm here. And I thought about that when I was still in medical school. And I wanted to become an endoscopist and not a surgeon. So now I'm a surgical endoscopist, basically. I know that there are pharmacists in this room. The role of pharmacists in the future is not really just being there in mercury drug, dispensing drugs, but the future is basically not only primary care, but now there is a trend towards specialty care. There are pharmacists who are able to give drugs and discuss with very, very good expertise among doctors and among peers on how to manage a particular disease in a particular patient. And so the pharmacist of the future, and maybe even the present, is a very empowered pharmacist, not just somebody who follows orders and gives drugs over the counter. And clearly, we also think about the entire community, not only in the local community, but of course, if you're global, you talk about global communities being taken care of by the pharmacist in a sustainable manner. The nursing profession is a challenge. It was challenged during the pandemic, and we thought that between now and the end of the decade, these are the roles of the nurses to even look at the remnants of COVID. But clearly, in the future, the role of the nurses are basically to stabilize the workforce. There's always a shortage of nurses. In the U.S., the nurses when you make rounds in the hospitals in the U.S., the nurses like 45 years old, 50 years old. Ang mga Pilipina lang doon ng mga bata. sa Pilipinas, walang nurses. Di ba? And there's always a shortage. And therefore, that is part of the role of nursing students to be able to sustain the workforce. And clearly, take care of yourselves. The mental health issues are important, and it is important in the medical profession, in other professions, but clearly in the nursing profession. And being able to balance your career and your life is important. And here are some tips to the ones who are dreaming to be nurses. These are some of the trends about being a nurse in the future, because there's always this whole person care that we want to give to our patients. There are very, very wide areas where you can grow in informatics. And clearly, we want the nurses to be also at par with the doctors that are working, because clearly you are going to be a very important part of the medical care of patients. For the nutritionists who are in this audience, yes, there are very, very important implications, not only in being able to create diets that are sustainable for the patient, that will sustain their life and their quality of existence in their disease states, but clearly there are other areas that you can make contributions so that you can have a diet that is sustainable today without sacrificing the future. And there are also a lot of trends in diet therapy today. This is a mouthful, and I know that these are some of the things that maybe you can read in the internet, but I think I would like to focus on those 2 bullet points at the bottom, because maybe in the Philippine scenario, this is where the nutritionists and dietitians can create some small contributions that can be magnified so that you can be a big player within your communities, but of course clearly in the entire country. Because today there's a lot of food wastage. If you go to McDonald's, they don't allow you to bring home the excess food. It's because they want to have control on pilferage. But clearly, you have control on pilferage, but you're also wasting food because all the remnants of the food every day are just thrown away. Now, in medicine, there's a huge buzz about the microbiome. We know that the concept about germs has changed. There are only bad germs, and we're being taught by our mothers not to eat something that dropped on the floor. But today, there's a concept that there are good germs and bad germs. Therefore, the good germs helps your immunity, digest the food to become vitamins, and the bad germs, of course, give you disease, obesity, and maybe even mental illness. And today, there's one of the most exciting part about medicine today is fecal microbiota transplantation, meaning that I can cure a patient by giving the stool of a very, very healthy patient to a sick patient. Okay, so don't be kadiri now. We're able to deliver that very decently, and I'm sorry that the ASEC of DOH is gone, because we've been applying for a license for fecal microbiota transplantation in this country for the last 2 years, and we never had an approval at all. So dito may problema ang Department of Health, no? Kasi wala silang masyadong proactive attitude towards science and advancement. But yes, there is fecal microbiota transplantation, very good for infections, very good for even autism, and very good promise for cancer therapy. And that is research that you can do when you grow. Today, therefore, there is a new concept about germs. Before, it was a cause of illness. Today, it might be the medicine for the future. Now, when we say research and innovation, as I said, when I was a young medical student, I was trying to create my future. And along the way, I was an endoscopist, and I studied the liver. And then now I'm doing IBD, which is a rare disease in this country. And that made me malleable and versatile. And as I grow older, I was still relevant, because that is the way I would like to be as I grow old. And therefore, when you do research about your future, about what you can do in the future, not only in 2030, but maybe for your class, maybe until 2080, then you have to do research so that you will be in the forefront of what you want to be starting today. This is my life. This is my biodata. So I was a teacher. I was a researcher. I was president of many organizations, and of course, at the end, you are rewarded. But what I'm trying to tell you is that you have to grow and mold and morph into something that is important within your specialty, but of course also in your community and of course in the country. But I always I have my young student here, Dr. Dane Lucero. He's a fellow trained to be a gastroenterologist. And clearly all of us wants to compete. But I live by these rules. If you want to compete according to the rules. And so the best way to do that is adapt a sport. Pag foul ka, foul ka. Pag out of bounds ka, out of bounds ka. Hindi ka tulad ng competition in the house. Kung sip-sip ka sa tatay mo, walang rules, di ba? So we don't want to do that. We don't want that model to be you to be as well competing in your workplace in the future. Now, as I said, research is important. All of us in the university are taught about the truth. When you are going to work, you are working and creating truths. You are also investigating about truths. And how do you do that? Research. You want to understand how peptic ulcer is produced, what is the truth about peptic ulcer, you do research. And research can propel you to become an important person in your communities. I am part of this crowd here in the UST that just came out from the varsitarian, and I am very proud to say that all these people, medyo nerdy na konti, pero at least meron silang pinagtandaan. All right? And we hope that all of you becomes part of this research environment in this university, because that is the essence of the university. This is one of my research papers that was published in the New England Journal of Medicine years ago. And I am quite proud of this, because this drug for hepatitis B, which is still the drug today for hepatitis B, I was part of the development of this drug from the very beginning. And then, of course, you are rewarded. We published a guideline for treating IBD during the COVID times. And this is a very, very important paper, because this was awarded as a top-cited article in the publications that is in gastroenterology. Of course, that is a nice certificate, but what is exciting is the day that you receive the email that, yes, you are one of those recognized. And this is one way of telling yourself in private that, man, you have made some contribution. And that is one dream that I would like you to realize, so that you will have to be a very, very engaged individual, not only today, but of course shaping your future. Now, in academia, when I was in India, I go to India a lot because I'm invited to speak there and I have a lot of colleagues. Akala nyo pulubing India? No. India is a very progressive country because there are a lot of people who are doing PhDs and doing a lot of research. And so if there is a very high respect for the Indian professionals, it's because of their engagement in academia. And what does academia do? We do research and we publish. In medicine and of course in science, we say you either publish or perish. The problem in the Philippines is that publishing and researching is not sexy, and therefore we need you to be engaged in research. Please, if there's a chance that you can do research, you do that, because that is the investigation of the truth. It is not the truth that you get from your teachers, but it is the truth that you can contribute to the world so that your teachers will also be learning from you. Now, everyone wants to be immortalized, and this is some lessons that we tell people. To be immortal, you sire a son, plant a tree, or write a book. And by publishing, you basically wrote a book. In the Philippines, we have published this internal medicine textbook because we thought that maybe this is an important contribution that all of us can make. Until today, most of the medical books are written by foreigners, which is really crazy. So at least in the internal medicine community, we have written some textbooks for the Philippines. Now, that is why I have my fellow here with me, because I want her to be learning from this talk, because now she's a trainee, but soon she will be a teacher, and soon she will be a mentor. Becoming a mentor and becoming an unselfish mentor so that you will be able to create clones of yourself who are much better than you is one way to become a very relevant individual and maybe also a very, very important father. So what we do today is create training programs so that people who are ambitious, who are talented, will be able to take care of ourselves, their teachers, and of course, the future of this country. I am always a believer in developing people. And when you develop people, you don't teach them, but you make sure that you empower them and then allow them to grow. There's this terminology called professional abortionists. These are people who are mentors trying to develop young people to become like them, but towards the end, they drop them. They don't want them to be part of their own specialty. In Healthway, for example, we want to welcome young people to be part of the team who are going to develop and treat cancer patients in the Philippines, because I think this is the way to go. The mentors and the students come together and start an environment of cooperation. Now, the fifth message that co-pilot told me is that to be able to be sustainable, you have to adopt a leadership role so that you'll be able to create change. But the most important is that you're only able to create change if you are also the epitome of that change. You are open, you are going to be cooperative, you have communication savvy, so that you'll be able to convince people and persuade them to be like you, to be better than you. In my profession, for example, I have been very noisy about IBD, and to me this is something that I am very proud of. Since coming back from training in 1990, I came back in 1988, and I thought that this intestinal disease called tuberculosis of the intestines was a disease that was taught to us to be present in the Philippines, and of course amoeba. When I was training abroad, they were calling it Crohn's disease and ulcerative colitis. When I was a student, my teachers tell me they don't happen in the Filipinos. They only happen among the Jewish population. But when I was in Japan, I was seeing diseases that I thought was TB, but the Japanese professor was saying, oh, this is Crohn's disease. So when I came back, I said, I want to change the paradigm and tell people that there is Crohn's disease and ulcerative colitis in this country, and so I formed the IBD Club of the Philippines. And today, I'm very proud to say that all the younger people or the younger medical students in this country believe that there is Crohn's disease and ulcerative colitis in the Philippines. Nung nagsisimula ako noong 1990, sabi nila, Joey, bayaan mo yan, TB lang yan, saka amoeba lang yan. Today, we are seeing patients and we are helping patients to be treated of this malady that creates holes in their vagina, creates holes in their bladders, and connects to the rectum. So very, very complicated disease, and therefore we are able to help patients. And this is what I call advocacy. Advocacy, of course, is a crazy mantra for some young people like you, but as you grow older, you will see that you can create change by being an advocate. Now, I don't want to talk about ambition and balancing with health because all of us want to be healthy. I must only advise everyone that everyone who's overweight in this room needs to shape up because a big belly brings a lot of diseases. But I want to end my talk with these last two items by giving you an example of how you can be a globally important individual by acting locally. I want to share with you the experience of my colleagues in Egypt. When the drug sofosbuvir was invented, it was the cure for hepatitis C. The treatment for hepatitis C before was interferon, which is a very expensive drug. Now it is a tablet. You can take it and then with interferon, you get treated for a year with injections, spend maybe $500,000, and the cure rate is only about 60%. Today, the drug sofosbuvir can cure you in 3 months, and it's a pill. And so what my friends in Egypt did was create a national movement to control hepatitis C, because Egypt has one of the highest population of hepatitis C. And today, look at the graph. In 1 decade, they have almost eradicated hepatitis C in Egypt, and now they are a model for the world. So the Egyptians acted locally, and now they're a global hero. And therefore, I want you to be one of those, to be wanting always to look for areas where you can become a local hero and become a global person. Now, for the pharmacists in this room, I think this is what you do today. As I said, you are part of the multidisciplinary team who manages patients today. Your opinions are respected by colleagues like the doctors, the medtechs, the surgeons in the team. But clearly, you are going to be influential, and you are encouraged to be influential and become a vocal member of the team. Kanina tinatanong ni Asik Domingo, sino dito ang taga medtech? Parang walang imik, no? Ganun ang taga-UST, hindi nagsasalita, no? So become vocal. May isang kaibigan ako dito, taga-Ateneo. Yung mga taga-Ateneo, medyo magaling magsalita. Ganyan dapat tayo. Di ba? So, sa UST, medyo matahimik ang mga estudyante, even in medical school. So I want you to become a little bit more vocal, create this capacity to communicate so that you become more an effective and relevant leader that you want to be. Because there is a role for acting locally, and of course there's a role for acting globally. For the nutritionists in this room, I'm glad that there is this college that is dedicated for that profession here, and some of you are here. These are some models in the UK that I want you to be reading. But clearly, in the local setting, we want you to devise diets that are made of Philippine vegetables and products that are available here, so that we can feed and treat and nourish Filipino kids and elderly patients in a very sustainable manner because we are using our local products. Now, clearly for the nursing students who are here, these are the challenges of the future for nursing. Make sure that you are going to be very, very caring personally as a human being, because if you're not very careful, the robots will take over your profession. Sa Singapore, meron na nagsaserve na mga waiter na robots. Mag-order ka ng tubig sa concierge, a robot will come to your room in China. Okay? So hindi tayo pwedeng mahuli doon. Now, most of all, most important is that I think everyone misses the point that all of us are part of building this nation. The nutritionists, the pharmacists, the medtechs, the medical students are part of nation building. It's not only the government who builds nations. We are supposed to be the builders of this nation. And therefore, I want that to be remembered by this group of students today here. And lastly, of course, is by becoming focused in your activities of your profession, of your ambition, being fulfilled in the workplace, you create a legacy. All right? And these are people who have had their names etched in history because they have created so much impact in society, of course, and of course in the lives of people. In my personal view, I think being able to introduce IBD in this country as an accepted disease that is now being studied and we are treating people and helping patients is one of the things that I am very, very proud to leave before I go. In Healthway, of course, as you have heard it, we are the first cancer-dedicated hospital in this country. And we are wanting to create a new system, a disruptive system, so that we'll be able to make cancer care a very comprehensive approach to treating patients with a very, very bad and life-threatening malady at an affordable cost. And with leaders like these who are in the pictures, who are very, very avant-garde in their ideas about how to deliver affordable health care in a national scale, we hope that we'll be able to also create a legacy for the country, and of course, hopefully for the region, and of course, for the world. So, when you are going to therefore look for idols so that they can become your role models as you grow older in your chosen careers, in your chosen profession, look for people who have had an impact, create and read about their history, and maybe copy or emulate them and modify them a little bit so that they can be adaptable to your resources, to your philosophies, and hopefully that in the future you also become one of those. As I've always said, I have very, very simple life rules. I live a good life, I thought, or I think. I have my family and I love them. Your family is your most important friends. Whatever you do to your kids will always be what you will be in the past, and of course what you will be in the future. And hopefully you'll enjoy your life and maybe create a legacy. So if you're looking for people to emulate and to copy, listen to the people who have good dreams. Look at the people who have formed a life that is worth emulating, and make sure that they become part of what you are, so that in the future you can live your dreams. Thank you very much for your attention.
All right. Thank you very much, Dr. Soliano. We will see you again later at the panel discussion. Now, if I have one key takeaway, it's what Dr. Soliano said. Excellence can be achieved by committing to lifelong learning. I'm so sorry, students, but learning does not end once you graduate, because it is a lifelong process. And speaking of learning, I have learned that a lot of you have not yet answered the survey. Why? You guys don't want to win prizes? Please scan the QR code as I will tell you what is up for grabs, because we are about to draw the morning sessions winners. There are gift certificates from AC Health of up to 5,000 pesos off on Health Check. Ayan na, na-excite na. Next, there's also health card from Maxi Care. We all want that, so please answer the survey. There's also grocery packages from the Medical City and Watson's gift pack worth 1,000 pesos. Okay, I see it. The phones are out. They're scanning the QR codes. All right. Now, let's continue learning. The next company is known to offer a wide range of hospital services using the latest medical technology and equipment. Get this. They also have been recognized as Hospital of the Year, not just once, but for the 4th time at the Healthcare Asia Awards 2025. It's none other than the Medical City. Now, for their presentation, TMC is taking a unique approach. We will play videos that highlight their ongoing efforts to deliver accessible, sustainable, and world-class healthcare across the Philippines. Now, let's turn our attention to the screen and watch the first video, an exclusive interview conducted by Manila Bulletin with TMC's President and Group CEO, Dr. Stuart Bennett.
Every patient that comes to us feels that they can trust us, right? And that they go home better than when they came to us, right? And that is the #1 aim for us. So, being best doesn't mean having the most hospitals. It means that every single person, when you ask them, if you were sick, where would you first choose to go? The answer should be the Medical City. And that's what we're striving for. So actually, this is not the first time I've done business in the Philippines. I had a business partner previously who's still a good friend, who I worked on software development in the Philippines before. So he runs BPOs, he also runs a software development company, and we built a health tech product together. And I think during that time, as well as the experience I had with working with Filipino medical staff in the UAE and the UK, I just feel comfortable working with Filipinos, right? The culture is very similar to mine. I'm half Italian through my parents, so the family values in the Philippines are similar to what I'm used to. I'm a Catholic, right? So I feel comfortable in this country. And to be honest, I think the Philippines doesn't get the recognition which it deserves for the quality of its health system. And if you look at Southeast Asia and you ask somebody, who has the best hospitals in Southeast Asia, everybody always thinks about Singapore, right? Maybe some aspects of Hong Kong and China, but generally they don't say the Philippines. So I want to be one of the people that's going to change that. The beauty of the Philippines is everywhere you go in the world and you ask people what is their fundamental memory of being in the Philippines, is that everybody was friendly, right? And people were kind and people genuinely wanted to help, right? And they're not just trying to get something from you. There's a culture of, despite all odds, people still battle through and they still carry on and they still manage to get the job done. And I think that's a very valuable DNA. So, I see that every day in the people that we work with. Despite many of the challenges with living in the Philippines, the traffic, the weather, the issues, right, the infrastructure challenges, and they don't complain, right? Sometimes they should complain more, right? And I want our patients to complain more, so our services are better, but that is part of the culture. So it's a very easy culture to assimilate into, but I think it's also, we have a duty of care to exceed people's expectations. In a country where people really expect less, I wanted to be able to deliver them more. I don't really bring old memories to new ones, right? And what I mean by that is, the things which I've learnt wherever I've worked in the world are the same, right? There is nothing different or better about how the Middle East delivers healthcare than how the Philippines delivers healthcare. But there are certain values which I think are important and consistent. So, what I want to bring here and what I'm trying to bring here is, as I said before, the focus on the patient experience, right? Many people say they care about patient experience, but they really don't, right? It's just lip service. And the first thing and the most important thing which I've discussed with my team is a Filipino concept, which is malasakit. Trying to repackage concepts from around the world into something which is uniquely Filipino and which Filipinos will truly understand and truly be able to get behind is what I'm trying to do. So we will adopt malasakit as a kind of war cry going forward in terms of how we deal with patients, how we deal with one another, right, and how we interact with the market as a whole. There's a few important initiatives we're already working on. One is our emergency department, right, and specifically how long people have to wait in our emergency department, right? And I believe in being honest about your issues and your faults and fixing them. So the waiting time in our ER, both for adults and children, has been too long, right, specifically in Ortigas. Some of the other hospitals it's not so bad, but here in our main hospital it's been too long, right? We spent a lot of time trying to fix it, which meant hours upon hours of being in the emergency department, spending time with the clinicians, understanding their challenges and their issues. How do you get patients moved through the ER more quickly? How do you make decisions about diagnosis more quickly? How does everybody collaborate together more quickly? And now the waiting time is 3 to 4 hours, right, consistently. Sometimes we go over that, but that's normal, right? So that's one. The second is around liver transplant, specifically for children, right? And I was really disappointed to hear that there are Filipino children who are being sponsored to travel to India to have liver transplants, right? And some of that sponsorship is coming from politicians and influential people in the Philippines who I understand have good intention, but it's the wrong message, right? The message should be, how can we provide that service in the Philippines? So we are working on our pricing for our liver transplant surgery. We had a very recent interaction with the Secretary of Health. We made a commitment to him that we would try and reduce the gap in pricing between, outside of the Philippines versus inside the Philippines. We're working on a package which is going to be almost at zero profit for us, right, in order to really bring the price within reach of the patients. And the beauty of pediatric cases for liver transplant is there's always a donor, right? The mother, the father, the uncle, the aunt. There's always somebody who's willing to donate part of their liver for their child, but the challenge is always financial, right? So we're working on a financial package which is more affordable and more achievable. We're not really profiteering, right? Whereas traditionally, unfortunately, many hospitals do that. We can service more patients at a more affordable price point. And once we've done that, we will look across the rest of the platform and we'll say, okay, where else do we have the ability to service more patients if we can bring the price slightly lower, but still make it meaningful for them and meaningful for us. So, we don't want to be the hospital for the elite, right? We also don't want to be a low value volume play. We want to be somewhere in the middle where we provide high quality services but at a price point which is reasonable for everybody. I think it's the legacy that any hospital CEO should want. If you have a high quality service to offer, and you have amazing doctors, and we have the best doctors in the Philippines, nobody can doubt that, right? And you have the best assets and the best resources, why should they only be accessible to a small part of the population, right? They should be accessible to as many people as can possibly service them. And so we want to spread, out and increase our reach to those patients who traditionally would not be able to afford our services. I would be very happy not to be remembered as long as TMC is remembered, put it that way, right? I'm not here to boost my ego. I know there's many healthcare CEOs around the world who like to spend most of their time on LinkedIn inflating their own presence, but I'm trying to do the opposite, right? And I'm trying to inflate the presence of the medical city, and I think that's an important message, right? You know, we are all as good as the institution that we work for, right, and we support, right? It's not about me, it's about the medical city, right? And the medical city is not about the medical city, it's about the patients who come and utilize the services of the medical city, right? So at the end of the day, I don't want to be remembered as anything other than the person who reminded us all that it's about the patients and not about anything else.
All right, now we know why the Medical City has been awarded Hospital of the Year, because they focus on malasakit, particularly towards their patients. Now, let's move on to the second video where TMC highlights their ESG, environmental, social, and governance initiatives, showcasing how they're contributing to a healthier, more sustainable future for all. Everyone, let's watch this.
At the Medical City Enterprise, we're more than just a healthcare provider. We're driving a sustainable future. ESG, or environmental, social, and governance, is a framework that guides us towards a more sustainable future. It's about balancing our commitment to patient care with our responsibility to the planet and society. We're taking significant steps to reduce our environmental impact, improve social well-being, and enhance our governance practices. Here's how. Environmental stewardship, minimizing our carbon footprint through energy-efficient technologies and sustainable building practices, reducing waste and promoting recycling initiatives, conserving water and other natural resources. Social responsibility, prioritizing patient-centered care and improving patient outcomes, fostering a diverse and inclusive workplace culture, supporting community health and community welfare initiatives. Strong governance, ensuring ethical business practices and transparent decision-making, promoting strong corporate governance to safeguard the interests of all stakeholders, encouraging employee engagement and empowerment to drive positive change. By embracing ESG, we're not just complying with regulations, we're creating a better future for our patients, our employees, and our planet. Together, we can drive a sustainable future. Join us on this journey towards a greener, fairer, and more sustainable future.
All right, thank you so much, the Medical City. How are you guys? How's everyone? Another final reminder, please, QR code. I see you guys. Before we draw the final winners, please don't forget to scan the QR code. I hope you're all picking up new ideas and inspired as much as I am. You know, all the sustainability efforts of the medical cities and the other brands inspired me to be more proactive when it comes to doing my part for the planet and for our country. Now, let's move on. Our next speaker is the Assistant Vice President for Watson's own brand health, exclusives, and business development. With 23 years of experience in top pharmaceutical and nutrition companies, she currently leads key initiatives at Watson's, including the expansion of Watson's generics, the vaccination program, corporate partnerships, and hospital store development. We have the opportunity to hear today about how they are providing Filipinos access to affordable medicines with Watson's generics and vaccination services through O+O channels. To let us know more, please let's give a warm welcome to Ms. Blesilda Espin. Good morning, Miss.
Hello. Good morning, everyone. So have you scanned the QR code? So you have to be very active this morning because I brought with me a lot of giveaways, samples for you to try, and of course, raffle items. So now that I hear everyone laugh, I think I can already start my talk this morning. So to the UST students, faculty members, healthcare partners, and distinguished guests, good morning. Today, I am thrilled and excited to be spending this beautiful Wednesday morning with all of you. I am tasked to share with you relevant, timely, and thought-provoking topic on health access, which is also very close to my heart. For the next 15 minutes, I would like to request all of you to focus your attention and give your 100% participation. My hope is that these 3 key takeaways will be achieved at the end of my talk. Number 1, as students and future leaders, you should realize that having good health is crucial in your future success and happiness. Number 2, health access is a shared responsibility between individuals, the healthcare system, and the government. And as students, you are catalysts of change and guardians of innovation. And you have the important role to play in improving it. And lastly, you are stewards and leaders of tomorrow. The future is in your hands, and that is why as early as now, you can be part of the immediate solution. Before I formally start my talk this morning, I would like to share with you 3 hand gestures that I'd like you to use this morning. Kailangan active participation kasi hindi na kayo gumagalaw, guys. Okay, so number 1, please join me, okay? So first hand gesture would be the thumbs up. Can you all do the thumbs up? Okay, so this symbolizes that you agree with what I am saying. Okay, clear? Number 2, okay, ito parang Gen Z millennial, the double raised hand. Okay, this one is sort of an exercise. So this is to show excitement and gratitude. And lastly, yung favorite nating lahat would be the heart. Okay, so this symbolizes love, support, and of course, your commitment. Okay. So bakit important yun this morning? Because what I will be sharing with you are things that you can already share when you go home. You can share it with among your siblings, of course your parents, and even your friends. Okay. So can we try the hand gestures first? Okay. So I'm going to say 3 statements, and I want you to have your version of how you interpret it. Okay, so the first sentence is, I brought with me some raffle items worth 1,000 pesos, which you can win later. Okay. So, what's your hand gesture? Mukhang may nanalo na, oh. Kasi naka-jacket, talagang kitang-kita ko yung pag-double raised hand niya. Okay, number 2 sentence. I also brought with me some Watson's generic samples that you can also try. Okay, nasaan na yung hand gesture? Okay, medyo active na din tong side na to. At saka to. Okay, yung doon hindi ko pa masyadong nakikita. Hopefully sa last, no? Number 3 sentence. Okay, the UST students are the best and the most beautiful people today. Okay. Okay. So thank you very much. Okay, so this morning my topic is about bringing health access to Filipinos O+O. Okay, so later you will know what O+O means. Okay, so let me start off by defining health. Okay, so what is health? As early as 1948, there was already a definition of health. And basically, that definition talks about being complete. So the fact that you are physically complete, you have 5 fingers, okay? So that's how initially they have defined health. But nowadays, health is not just defined on the basis of being complete, but also on the basis of having physical, emotional well-being, especially associated with the state of being normal, meaning the function is working very well in terms of the human body, and of course the absence of disease. But on top of that, I think what we also need to understand when we talk about health, it's also the aspect of being balanced. So meaning not just because you have the complete sensory, you can do everything, you're not sick, that means you already have good health. Nowadays, we also need to check whether our mental, physical, and also our emotional has this well-being. Okay, so we have to make sure that each facet or dimension of health is actually working very well. Okay, so why is this important? Because health is wealth. Okay, so who believes that health is wealth? Can I see hands? Okay, so why is that? Because I think during the pandemic, most of you are already doing your school at home, no? So it's very boring. But during that time also, we all realize and we are awakened by the fact that actually the biggest asset that we can have at that time is actually our own health. So can you imagine a lot of people dying and they're very rich, and at the end of the day, we are just very grateful that we are not that rich, but we are well complemented because we are healthy. And at that point in time, we believe that life is short, therefore we have to make sure that we live it to the fullest. And I think at this point in time, we also need to realize that that statement is still true. And why is that? Because, okay, good health is actually the most valuable asset that we can have. It is the foundation on which a fulfilling life can actually be built. So there are 4 important things that I want to give to all of you. Okay, good health actually allows us to live and enjoy life to the fullest. Can you imagine a classmate of yours or probably a family member who is not in a good state of health? So although this person is very talented, it's also very challenged in terms of doing the things that he or she likes. So just by being healthy, we realize that we can actually live our life to the fullest and enjoy it. And that in itself actually is a blessing. Number 2, healthy individuals are more productive and successful. And I myself experienced that. So sometimes there are high performer, extremely intelligent people, but end of day, they are always absent. At the end of the day, who gets the job done? It's the person who's always present. Sabi ko nga, diba? Being able to show up every day despite all the challenges is already a success. And sometimes we will get to the point that we will realize, yung classmate ko ang talino noong time na yun eh. Kaya lang lagi kasi siyang ina-asthma. So pagdating sa work, lagi siyang hindi nakakapasok. And sino yung na-promote? Yung tao na healthy, yung hindi nag-absent. So that in itself is already okay. That goes to show that if you are healthy, you can be successful. Number 3, maintaining good health contributes to financial stability because you will not incur a lot of medical expenses. Imagine your parents being able to save that money instead of going to the hospital or buying medicines. Your parents will be able to give that to you para you can add to cart. Diba? Ang sarap nung ganung pakiramdam. And lastly, having good health allows us to live life and achieve more goals. Okay. So, what is then health access? So, this is one of the challenges that we are facing right now as a country, no? And you might be asking, ano naman ang pakialam ko dyan, ang bata ko pa, problema yan ng gobyerno. No, every one of us should be involved. Why? Because as I have mentioned earlier, you are the future of this country. And imagine that this health access can actually be your potential problem when you become parents later on or when your parents become elderly. And why is that? Because when we talk about health access, it actually means the timely use of health services to achieve the possible health outcomes, be it for individuals, community, or populations. And currently, there are 3 barriers to health access in our country. The first one is the rising cost of healthcare. Sabi nga, di ba, dito sa Pilipinas, konting galaw lang, meron na agad bayad. Okay? And the problem right now is hindi naman lahat ng tao will have access to free medicine, free doctor consultation, and even medical services. That is why it becomes now a barrier for everyone to have the access. Number 2, there's also shortage of healthcare professionals. So this morning we heard about Dr. Soliano. So Dr. Soliano is one of the top doctors that I respect when I was still part of Unilab. And most of our new products, siya talaga yung kinoconsult namin. And right now, the problem in our country is that because Filipinos are really very good doctors, nurses, pharmacists, and even dietitians or nutritionists, they are being invited to join other countries. So ang nangyayari, tayo yung nagsasuffer, di ba? So tayo yung nawawalan. And there's actually, the shortage is probably now nurses lang. But I think in the future and very soon, lahat na ng healthcare professionals, we will have shortage because Philippines is already 113 million. So you can just imagine how many doctors, nurses do we really need in the country as we increase our population. And lastly would be challenges. So this could be in form of time, of course. Right now, less work from home. Okay, there's also the problem of transportation because of traffic, because of geographical locations in the Philippines. As we all know, diba, we are more than 7,000 islands here. And then, of course, yung workload or sometimes yung capability natin to be absent just to consult our doctor. So these are the common health access problems that we are facing. Okay, so I'm from Watson's. So for the next few slides that you will be seeing, we will talk about how Watson's is helping solve the problem. Okay, so this is now the commercial side of it. So Watson's is actually a joint venture of SM Group of companies and AS Watson's, which is a global company based in Hong Kong. So we are the #1 health and beauty retailer in Asia, not just in the Philippines, but Asia, because Watson's is actually a global brand. And one good thing about Watson's is that we help in bringing health access as early as now, we have the strategic vision, we know the problem, and we want to be part of the solution. So my goal this afternoon is to share with you how we provide solution and how we can partner together to solve the different health access barriers I have mentioned early on. Okay, so Watson's is actually a store with 1,175 stores nationwide. So we are now strategically located from Luzon, Visayas, Mindanao. And most of the time, we really pick the places where we think there's no a nearby store that can serve the community. So we have 4 different formats because we believe that each shopper has a different shopping mission. Okay, so what do we mean by shopping mission? For example, okay, sabi niya, I will go to Watson's to buy my mom's medicine. Sabi naman ni ate, ako naman, I will buy for my beauty needs. Okay, sabi naman ni lolo at lola, gusto kong pumunta ng Watson's, gusto kong magpa-vaccinate. So there's different shopping mission, and each shopping mission, we made sure that we have different store formats to address that. So meron kayong makikitang Watson's na sa dep store inside SM. We also have Watson's store inside the supermarket. Okay? We also have the Watson's store in the community, and we have Watson's store inside the mall. So each of the stores has its different purpose, and the purpose is actually to serve the Filipinos. Number 2, okay, I have mentioned earlier that one of our problems is the rising cost of medicine. And this is where Watson's now plays a crucial role. Back in 2002, we launched Watson's Generics. And the simple reason is that we wanted to provide options, cheaper medicine options for those who are struggling financially, or for those people who just really wanted to save. So what's the rationale behind that? Because end of day, what Watson's is pushing is actually compliance. Let me share with you a very interesting story. This is my personal story. So it happened sometime in 1998. I received a phone call that my mom was rushed in the hospital because na-stroke siya. So at that time, I was still in college, and I'm really like, what will happen to me? Because my mom supports my education. So matatapos ko ba yung college? So di ba nakakatakot siya? But at the same time, I'm also worried about my mom, mamamatay ba siya? So luckily, my mom survived. But you know what happened? Sabi ko, ano ba yung naging cause? Ba't ba na-stroke yung mommy ko? And looking at the real cause, it's because of compliance. She was not taking her medicine on a daily basis, and she has hypertension. So what's my message today? If you have parents with comorbidities, so what are these? Hypertension, diabetes, okay, cancer, COPD, kidney disease, all of these are chronic conditions, and they need to take their medicine on a daily basis because we don't know when will the condition worsen. And if your parents are not taking their medication, you can be in my situation. At that time, I would call it shattered dreams, no? So when I joined Watson's in 2023, the first thing that I did is to actually check the portfolio of products that we are offering because we want to make sure that we serve the customers by doing it right. Kasi at the end of the day, hindi naman lahat ng generics quality. Diba? And there's the fear na baka hindi naman siya mag-work. But basing on my experience, and because nanggaling ako sa situation na ganun, I don't want other people to experience the same thing. So I really check the quality of products that we have. And I'm very happy to share with all of you that Watson's Generics is actually a quality generic brand. And at the same time, it provides savings up to 80%. So kung struggling kayo financially at yung mommy nyo, parang mommy ko, iinom today, magsiskip mamaya, iinom bukas, skip uli, then that's the option that you can share with them. Mami, baka gusto mong lumipat ka na lang, huwag ka nang mag-branded kung hindi natin kaya. Pero inumin mo yung gamot mo araw-araw. Okay? So, one thing I can share with you, the products that we have goes through a crucial 5-step QA system. So kung meron kayong if you know somebody who's struggling financially at hindi umiinom everyday ng gamot, you recommend Watson's Generic. We are the only company also that promotes compliance. Anong ibig sabihin nun? Kung good for 30 days yung bibilin, merong 30% discount. So, you can go home now and tell your mom and dad, wag na po kayong mag-skip ng medicine. Kung hindi natin kayang branded, you choose Watson's Generics. Okay. Number 2, medical services. So, as mentioned earlier, one of our problem nowadays is access. Malayo kasi, mahal. Okay, mamamasahe pa ako. And one thing I can share with you is that with Watson's, we know the problem and we want solution. We are now offering medical services. So if you go to Watson's store and you see the lady, okay, yung pharmacist namin, may nakalagay na vaccination services, you can avail the vaccination at a cheaper cost. Kasi sometimes, di ba, there are those people na wala namang sakit. They don't need their doctor. They don't need to go to their doctor. But if you have medical condition, of course, you can go to your doctor and have yourself vaccinated also. But not all doctors kasi are vaccinating doctors also. That's why we open our doors for vaccination program. So you can get vaccinated at Watson's. Senior citizens still gets their discount. On top of that, there are also stores that offers free medical consultation. So di ba may mga instances na hindi naman kaya lahat na magpa-consult sa doktor. So baka may kilala kayong ganun, pwede niyong sabihin, si Watson's may free consultation. Ate, kesa umuubo ka dyan, diba? Pumunta ka na sa Watson's, may free consultation. Okay, what else? Of course, meron din tayong free BP monitoring. So may mga cases kasi. Who amongst you? May mga moms, dads, or grandfather, grandmother who take their BP monitors every day? Every morning, meron? Konti. Siya lang talaga yung active. May special prize ka mamaya sa akin. The lady in red jacket. Okay. So bakit siya important? You have to encourage your mom, your parents, to take their BP every morning. Why? Because sometimes our parents are walking bombs, time bombs. Kasi hindi nila alam high BP na sila. Hindi sila umiinom ng gamot or hindi sila aware. So my message this morning, wag nyo nang gayahin yung nangyari sa akin, di ba? My mom is not taking her BP every day. So nung time na high blood siya, okay, she was exposed to a lot of stress at that time, and then yun, na-stroke siya. Okay, so if in case meron kayong kilala, pwede nyong i-refer sa Watson's store to have their BPs checked. It's free. Okay. Next is O+O. Okay, this is actually for all of you guys. Why? Because O+O means offline plus online. Offline means visiting our physical stores. Okay, so if you have the time, the luxury of time to enjoy and go and move your body, then you can go to a Watson's store anytime, anywhere. But if you don't have the time, you don't have, you're so busy with schoolwork, your moms doesn't have ample time to go with you also, you can just go to the app. Okay, mommy, pwede kang bumili ng prescription medicine mo. Let's download the Watson's app. I-deliver siya ng free. And then, if you want your medicines na automatic na dumadating, mommy, i-refill nila, you just have to scan your prescription, load it to the app, and then Watson's can give your medicines every 30 days. So you can refill your medicines also at a discounted price. So that's how ready Watson's is in ensuring that health access is not going to be a burden anymore. And your generation can actually help the older ones, those who are not tech savvy, those who are not into apps. You can spread the news that this kind of service is actually available for them. Okay, and this is actually my favorite. I think before we close lang, I just want to introduce that I am joined by our Senior Brand Manager for Sustainability, Lexi. Okay, so Lexi is our lead for sustainability. And this is first among the retailer or the pharmacy drugstore in the Philippines. We are the only retailer that supports sustainability. And Watson's in support, we know that the generation will still need to enjoy what we are enjoying right now. So we want to be actively promoting sustainability. We do that by making sure that we produce products that are sustainable choices, okay, made from ingredients or from packaging that can be recycled. On top of that, we also support diversity. We also support different initiatives that will help and promote sustainability. That's through our people. So we are very active in doing tree planting, medical missions, and of course, later on, you will see the video of Watson's on sustainability. And lastly, in summary already, okay, hindi ko pa nakikita yung hand gesture nyo. Can you request for the hand gesture of everyone? Okay? Okay, so in summary, together with Watson's, we can help continue to improve the health access for all Filipinos by offering the following. For the rising cost of medicine, we offer Watson's Generics. For the shortage of healthcare professionals, we offer our health services such as vaccination, free BP monitoring, glucose screening also. And lastly, to address the busy schedules, the different challenges when it comes to transportation and also work-related issues, we have Watson's digital app, which is an O+O initiative. So together, dear students, friends, and guests, let's all work together to enhance and improve the health access in the Philippines. Thank you very much.
All right, thank you so much, Miss Blisilda Espin. Now, you know, there's so many products of Watson's, and I can attest to the sustainability aspect of that because I am a fan of the Watson's natural products because they have all the bottles that they use are really made from recyclable items. And also the Watson's stores that carry the vaccination program as well as the consultation. I didn't know, Miss Blizzard, meron palang consultation because the vaccination, I am very familiar with that. So while that's setting up, chika ko lang kasi I use the app and I like that how I can order, and we have a Watson's store in our building. So pagka-uwi ko, diretso kuha na lang ako ng product. Na-order ko na, no need to line up. Everything is super convenient. And it's good to know that there's an O+O. Yun pala yung meaning nun, offline and online. All right, so now that the Sala Chikahan portion is already done, may I please call back on stage Dr. Solano to represent AC Health, Mr. Philip Kuunhing from Manila Bulletin, and Ms. Blisinda Espin from Watson's. To represent also the voice of the academe, we invited two UST representatives from the Department of Nutrition and Dietetics. We have a registered nurse dietitian and soon-to-be Doctor of Philosophy, Assistant Professor Dayan S. Mendoza Sarmiento, and one of BS Nutrition Dietetics student, Ivy Elise Meristela, to please come up on stage. So we will begin our panel discussion. Ayan na, chikahan portion na yan. Ayan, o clap, come on. All right, good morning everyone. Good morning. All right, I know there's a lot of information that we have to unpack. So I'm gonna start with Sir Philip. For someone, I'm an advocate of health and wellness, but for someone who is not in the field of medicine, yan, what does it mean to have a sustainable health care? Ano ba yun? Diba?
Yes, well, I think the ones who are here on the stage are the ones giving the answer to that, no? And I think what I actually wanted to ask first of all was Dr. Solano, when you had the slide about the 4 impactful leaders, I couldn't recognize who was the girl on the left. Because I saw Nelson Mandela, Steve Jobs, and Zelensky, no? Of Ukraine. I didn't recognize who was the girl.
That
on the
was
left.
Rosa Parks.
Rosa Parks.
Yeah, Rosa
okay.
Parks, the black lady who refused to budge from the chair.
From the bus. From the bus.
Including
Okay. So I think some of the
civil
people
rights.
here I know were also wondering who was the lady on the left, no? So at least it's Rosa Parks. Are you guys all aware of what the story behind Rosa Parks is?
Are you guys aware? Yes? No? Baka ako hindi ako aware. Philip, can you tell more? I'll be honest, guys.
Okay, so Dr. Solano, baka you can make kwento a little bit. 1940s or 1950s?
In the early part of America where racism was really bad, they were segregated. The blacks and the whites are segregated, even in the buses. In UST, for example, who goes to the main building here? In the main building, it's now rusted, but there's a stairway for males and there's a stairway for females. Of course, that was maybe a religious edict, but in America, there was so much racism that the blacks cannot ride the bus of the whites. And Rosa Parks took a bus for the whites and refused to budge when a white man came up and pushed her away. And she started the civil rights movements in America, and she's an icon for that and being credited to that. So one act and sustained by her campaign to really promote human rights and civil rights made her an icon and an idol and a hero.
Maybe you could hear first from the faculty members of UST in terms of their reaction for the two speakers today, and if there were any questions they wanted to ask any of the two speakers.
Okay, so I think first let me share how we view sustainability in terms of academe. So being an academician and of course later as a student, we see ourselves in the grassroots of sustainability because we have both the privilege and responsibility in terms of capacity building. We hone future nutritionists, dietitians, and other professionals, medtech, pharmacists, doctors. So we see ourselves, it's both a privilege for us because we can do something about it, right? We advocate sustainability. We advocate in terms of addressing malnutrition. Severe acute malnutrition is part of universal healthcare, and we're happy that that is included. But it's just one of the primary nutrition problems that I think we should still lobby to be included in universal healthcare. So in terms of academe, we equip students with such concepts to make them, in the Tomasian community, committed, compassionate, and also competent in addressing these issues in terms of health and nutrition. So these are all integrated in terms of our curriculum design. So we offer, in terms of designing our course, I'm sure Dr. Solano very much, for several 50 years or so, has been attesting to that. So we design our curriculum in terms of addressing these nutrition and health-related problems. In terms of, for example, course activities, we make sure that we practice sustainability. So again, not only in terms of concepts, but in terms of practical aspects. So we promote diet diversity, personalized nutrition, issues on obesity, issues on non-communicable diseases. So we tackle that in terms of our course activities. Placement in terms of practicum, we have students placed in both government and hospital institutions and also in community settings. And they have really hands-on in terms of how they can implement activities that can help in addressing, again, pressing matters in terms of nutrition. So in addition to that, the College of Education also has the nutrition clinic. So we have extension services. We cater not only to the Tomasian community, but also to other stakeholders. The nutrition clinic also has dedicated lactation room to really support the value of exclusive breastfeeding. And in terms of sustainability, it's really, I mentioned to kanina, the practice of, or the concept of first 1,000 days. Okay? So it's really important, or really have an impact in terms of promoting nutrition and healthcare. And it really helps in terms of sustainability. When we say sustainability, kasi I view it as being able to contribute to Filipinos or future Filipinos that are healthy, well-nourished, and also productive, and can be a good members of the society. Okay, so it may seem very far, diba? But in essence, that's how we see academe, our role as an academe in terms of really achieving or contributing to that sustainability.
So as a nutrition and dietetics student, in our field, we don't just stay in classrooms. We immerse ourselves to actual communities. We go there. So what do we do there? We assess what their needs, make nutrition education materials for them, because as said earlier by Secretary Ted Herbosa, information save lives. So as future health educators, that's what we take part on the proactive side. As future health educators, that's what we do as a student.
I want to throw this to the members here, no? Because universal healthcare is supposed to have three real aspects, no? The preventive, the curative, and the palliative. Here in the Philippines, I think right now it's mostly based on curative, no? It's only when you get sick that you actually try to avail of something. So what do you feel would be the messaging or the takeaway for the students here today in terms of what your particular company or the ones you represent are doing to try to improve that aspect, no?
For Watsons, I think we are the only retailer that really push for wellness. What we are doing right now is we believe that diseases can actually be prevented by doing an active role. So if you visit our Facebook, Instagram, you will see how we promote awareness on disease conditions and how it can be prevented. Because at the end of the day, while we wanted people to buy medicines and comply, what we also want is for people not to get sick. We want people to use our products, our wellness products, to prevent going to the doctor. And I think sustainability is not just about products also. It's basically about people. And saving people from disease condition is very important as part of Watson's strategic role. We made sure that each effort is geared toward prevention, also, and we made sure that we are also aligned with the current needs of the people, students, Gen Zs. If you look at our stores, it's very aligned with the young ones, no? We really wanted, because we believe the future is actually in all of your hands. Okay, so how can we encourage you to go to our store if our store is not within your genre, if it's not something
Not
that
aligned
is
with their
aligned.
vision, their
Oo,
aura. Tama
diba?
ba? Tama ba yung gamit ko ng aura?
That's why when you go to Watson's store, the very moment you step in, you already feel that this is my store. Okay, because we don't want to be known for medicines. We want to be known as a wellness.
Yes, I can attest to that. Hindi talaga siya nakaka-intimidate to go inside. Like, it's not just the medicines you're there for, you're also there for other products as well.
And I'll give also credit to Watson's in terms of accessibility, because how many locations do you have now?
We are now located in 1,175
Oh,
stores.
memorize ko yun, Miss Blesinda. Parang palapit na sa islands ng Philippines yung dami ng stores ng
And the goal
Watson.
actually is to launch 80 new stores every year.
Wow.
Yes.
Talagang accessibility everywhere for the Filipinos.
How about you, Doc? You were going to talk about that curative, palliative.
Thank you very much for that very interesting question. I view this from both a teacher's perspective as a professor here, of course now as a medical director at Healthway. As an educator, I think prevention is always the best medicine. And here we educate people, and hopefully we educate people on how to become a healthy individual. Today, obesity is a bad epidemic, and therefore we need to educate the students on how to be educated themselves, how to progress this education to their families and to their friends and to the group that they go around with. And of course, in your course, creating healthy diets which are palatable and acceptable to the Filipino taste is important, and that is where sustainability is an issue, and we need to be able to do that. On the hospital side, for example, in Healthway, we are the first cancer care hospital in the country, and we're very proud of that, and we want to grow. We're just about a year and 3 months operating, and therefore we have this vision that we'll be able to change the healthcare system in this country by creating programs for preventing disease. And so we are into lay fora, we go to communities around the place, and maybe hopefully in the entire country using the other Healthway smaller clinics to be able to pass on this information, this awareness, this education on what is healthy. Because health is wealth. That does not become a very important adage until you get sick. And during the pandemic, as Bless was saying, a lot of rich people had to go to Pampanga, had to go to Santa Rosa to get confined. They had $100 million in their bank accounts, but they cannot get a room. See, this is very important. And so at Healthway, we are into vaccination, we are into education, we are into creating programs that are executed in the community level, as well as, of course, enhanced in the hospital so that we'll be able to get preventive education practices and systems that are able to address all these issues.
Sir, may I add to that? So I would just like also to maximize the platform to promote or advocate nutrition. So sir, we're talking about prevention. And I think I would like to emphasize the role of nutrition in terms of prevention. A lot of studies have really provided evidences in terms of the cost efficiency of different dietary recommendations, sodium reduction, increasing fruit and vegetable or fiber. And I think in terms of sustainability, in terms of profession, yun pa rin po ang isa sa mga pinaglalaban namin, that nutrition is or should be a forefront in terms of also achieving or promoting sustainability. So I hope that, of course, kasi po yung mga student natin is nutrition. So, kaya niya yan. Okay, so wait lang. Kasi may question kanina si Sir, di ba? Parang yung question niya is yung existential question. So is it really what you want to, so bear in mind that, if you really would like to contribute, okay? So second year, third year, fourth year, so kaya niya yan, siya natatapos na. Okay, so I hope you appreciate the role of nutrition in terms of really promoting health and sustainability in the country, locally and also globally.
But question also, correct me if I'm wrong, but the perception I know for a lot of people is when you're going to talk about food that's healthier or di ba, what do you call it, organic, etc. Ang problema is mahal.
Yes. Mahal ba talaga?
To have a healthy diet is also to have to spend more. And so how do you counter that, or how do you now reduce that argument?
Okay. In terms of healthy diet, we don't really have to look into what's organic, right? The free range. It's really more of taking things in moderation, okay, and maximizing local indigenous products.
So, moderate chicharon, ganon.
Well, yes, a dietitian will never say no, there's no such thing as really bad food. So if you eat one piece of chicharon, that will not really contribute to your hypertension.
Correct.
What
Basta one piece lang.
Yes. But what
contributes,
if you consume it, sir, daily, along with the sodium, the rest, the obesity, then that will lead to hypertension. Okay? Yeah. And yun nga po, the role of indigenous or local food items na sadly medyo nawawala na nga in terms of today kasi lahat westernized. Yeah. So in terms of diet, in terms of palate, very na tayo, nag-iba na rin. Yeah. So yes. the indigenous products, fruits, vegetables that can be incorporated part of the diet is cheap. Okay.
For those who are into that nutrition aspect, in fact, I'd like to mention, the first speaker after the lunch break is Juana Manahan Yupanco. So she's behind Mesa ni Mrs., and that one really promotes local vegetables. She wants to sort of like a meal for 4 persons should not cost more than 150 to 200 pesos because it's all locally sourced and yet does not lose any of the nutritional requirements. No, she took up a master's in University of Edinburgh about nutrition and world,
may I just add, I completely agree with what you're saying because I'm also a nutrition advocate. I launch a lot of nutritional brands in the market, and the goal actually is to help people who are sick because most of them are compromised, When you are sick, when you have cancer, you eat less and less, and the chances of surviving is actually very low because you cannot eat as much as you can, So I think what we can do, I'd like to encourage all the students here, at Watson's, we are actually towards sustainability. So you might want to start harnessing all your talents, why don't you come up with healthy food, beverages that maybe when you graduate, you can sell to Watsons? These are sustainable
alam nyo na,
products.
students, take note.
Entrepreneur na kayo.
Yeah, oo,
Ma'am,
I'd like
we
to
have-
your chance.
Can we submit research output? We actually have few students who focus on product development,
Yes,
and
yes.
we'll
The
get in touch with
R&D.
you to submit research proposals and outputs so that meron po future ang kanilang research.
Yeah, because in the Philippines, if you who travels a lot here, okay, pag nag-road trip kayo, nakita niyo ba, we have a huge land, but we are not actually utilizing it. So my challenge among the nutritionists and dietitian students here, why don't you harness the knowledge that you have learned already to come up with products and services that can be sustainable in the future? Because I believe, no, what your teacher just told us, diba? Most of the products that we are selling here are actually from different countries. And it's about time that we do an active role in also exporting sustainable products from the Philippines. We have a huge land, and moringa is actually one of the superfood that we have. Ako, I'm also taking moringa, no? Oo.
I'm a fan as well.
It's really very beneficial, and siguro what we can do, no, plant and then at the same time take it,
Yep.
diba, and advocate it, and then later on think of other products that you can actually do with all the dahons that we have here in the Philippines.
Mga dietitians ha,
Oo,
mga
that's a
malunggay,
challenge.
pandesal, mga crackers, anything that the future generation, like especially even my kids, could like really utilize when they're older. Para healthy generation.
Yes, if you go to Watson store, we have a healthy portion, that healthy food beverage. But if you look at the current products that we are selling, konti pa lang siya. So that's why I want to encourage everyone here, be an entrepreneur, use your knowledge, use your skills to think of something to support sustainability in the future.
Okay, Doc, if you don't mind, I'll throw the question out to you. No, the Cancer Care Hospital you set up in Arca South. No, what do you think contributes to this day the fact that in ASEAN countries the Philippines leads in terms of breast cancer cases and fatalities from breast cancer? Because I mean, most people will say breast cancer, if caught early, is one of the easiest to cure, and yet the Philippines leads in terms of fatalities. No.
I think the problem with the Filipino mentality is that we are very reactionary, and we don't save money for illness. We don't save money for preventive consultations or preemptive maneuvers to maintain health. And that is why mortality is high, because most of our patients are detected late. And therefore, at the Healthway Cancer Center, for example, we have all these programs for early detection. Second is that access to care, which is really important. Always expensive. And why is it expensive? Because the Filipino brain doesn't save money for illness. You save money to buy a new Louis Vuitton. You save money to buy a new YSL bag. But you don't save money for illness, which is a definite event in your life. And yet, you don't save for it. So you spend for a Uniqlo, for example, or maybe a more expensive shirt, and you save for it for 3 months. When the moment that you buy it, it's really, really cheap because you have money in your pocket. But if you are sick because you didn't save money from the past, 1 peso is so expensive. And that's why I think this is where the messages for these young people here should be that once you are working, you should save money for the rainy day. And the rainy day is illness.
And I think we'll also have one of the HMOs talking later on this afternoon. So coverage is very minimal pa rin here in the Philippines, di ba? People will do a lot, spend, like you were saying, they'll spend for so many things, but they won't spend for medical coverage.
Yeah.
They're not always thinking of the eventuality. In fact, they'll just think about it when nakasakit na sila, hindi ba?
Yeah. Very, very important messages, I think, that we need to take this opportunity.
On this part, sir, up to now, it's what? It's still breast and lung cancer, which are the leading causes of cancer-related deaths here in the Philippines?
Breast, liver, lung, and then, of course, ovarian cancers are,
But have we ever actually studied the causes? Why would the Philippines be leading in terms of breast cancer cases within ASEAN countries? What would that be attributable to?
I think the statistics is that we are one of the unfortunate people where the mortality from breast cancer is high. But we're not the ones that have the highest breast cancer incidence in the entire ASEAN region. But of course, today we blame diet, we blame the pollution, and we blame pollution in diet, basically, because all the food that we are taking has a lot of antibiotics, insecticides, and we take it in vast quantities. And today you are talking about diet that is healthy. We hope that we can create certain icons, Filipino icons, who are advocating good diet and healthy diet, which is not copied from the West. So that, as you said, again, sustainability from the indigenous products, not really organic, because as long as you take it in good measured quantities, food is always healthy.
It really boils down to diet talaga. So mga dietitian, alam nyo na, meron talaga kayong purpose to really educate everyone that it really starts on what we eat, what we put in our bodies, and everything else follows, right, Dr. Solano? So thank you for the wonderful insights. Now, before we open the floor for questions, please allow me to ask this initial question submitted by our audience today. Number one, with the rise of telemedicine and digital health apps like what Ms. Brisilda was mentioning a while ago, how can we ensure that technology-driven healthcare remains inclusive and affordable for all sectors of society? Ms. Brisilda, you want to answer this?
I think a while ago we were talking ni Dr. Solano na, so parang we were mentioning that when you go to a salon, okay, you are charged 500 pesos. And then when you go to a doctor, sometimes we complain for being charged 300 pesos. Okay, so my point is the doctors, okay, the healthcare professionals, the dietitians who are present here, you all spent years of studying because you want to make sure that you provide the best possible care. Okay, so I think cost, yes, it is an issue, but end of day, we all wanted the best possible care that we can all have. And just treat it like, if I'm going to a salon and getting a haircut, which will last for 3 months, versus going to a doctor who will save your life for the next 5 to 10 years, and you're being charged 700 to 1,000 pesos, why would you complain? Okay,
when you put it that way, so now talagang okay, it makes sense. Right?
Yes, and I think for you, Estino, you are one of the promoters of health because you offer a complete portfolio of courses that are health related. So I think you're also the best people to talk to and the best people to discuss this to different individuals also. If you value your haircut, all the more that you need to value your health. Okay, telemedicine is currently, based on the information that I have, it's already on a downtrend. Why? Because nothing beats physical or face-to-face check-up. At the end of the day, your doctors would really want to make sure that they can really see and feel you. Okay, and even for the elderly, they also wanted to see their doctors. So I think nowadays telemedicine is just an option, just in case you experience something and you don't have the time to go to a doctor. But end of day, I think what I would like people to do is to make sure that they have their annual physical checkup, because that will prevent you from spending too much later on because you are not fully diagnosed with certain disease condition. Mm-hmm. So for the young ones here, my message is, if you are predisposed, if you have a strong family history of chronic diseases, you have to have yourself checked. Okay, so if you have strong family history of hypertension, diabetes, chronic kidney disease, COPD, and of course cancer, go to a specialist. Do not wait for the symptoms to become very, very severe and complicated. And then the last thing that you'd like is, of course, use all your savings to save yourself. Because end of day, as I have mentioned, nothing beats good health.
From a medical standpoint, when do people start? When do they start? When should they start? Having annual medical checkups.
Well, let's do it. I might answer it in two different ways. If you have a family history of cancer, for example, if you have a family history of sudden death, we encourage you to go and see a physician for consultation and listen to suggestions for early monitoring and maybe workup. And I would say people at this time with a lot of stress, maybe at 30, if you have that kind of family history, you should be very, very friendly to your doctor. For patients who have cancer in the family, depends on the risks. For example, in colon cancer, we say that at 50, Filipinos have this rising incidence of colon polyps. So we recommend a colonoscopy at 40, at 50. In America, because of the diet and their lifestyles, people in America start to get polyps, which are the precancerous lesions in the colon at 45. So now they encourage people to get screened at 45. So screening is important at certain ages. Depends on the risks of patients, individual risks. Yes.
Because typically here in the Philippines, like an executive checkup, unless it's sponsored by the company, individuals probably won't bother doing it, diba? So like, I don't know, like you students out here, when in your minds, when do you think you should start having annual checkups, no?
So speaking of students, Philip, I think we can open the floor for questions from our audience. So if you guys have any questions, please feel free to approach the mic. Anyone? Dietitians, educators?
Here's a student on the right side.
Hello. The first brave soul.
The brave first one. Naka-shorts pa. Okay.
Good morning.
Hello, good morning to everyone in the panel. I am Jester Chan from the College of Tourism and Hospitality Management, class of 1H1.
Hello, good morning, Justin.
Cheering, doon lang sa may kanan.
And my question for the panel is, how do we shift the mindset of Filipinos from treatment-focused healthcare to a preventive healthcare culture?
Oh, Dr. Solan.
Great question. We are in academe, and I always say, when I was in that interview in Makati, I said, preventive medicine should be taught in the family, because we need to educate our kids to have that kind of mindset. If their parents are, as you said, treatment-based or treatment-driven mentality, then that is already a disaster, because we need to educate people when still they were very young. How does it translate to prevention? Vaccine acceptance, which is when you are born, you did vaccination. Remember that maybe 70% of all the cancers in this planet is caused by infection. See, gastric cancer is caused by H. pylori. It's a bug that infects your stomach. Lymphomas are caused by EB virus. Cancers of the lungs, some of them are caused by viruses. So infection is preventable by a vaccine. A lot of disease now have vaccines that are available. So we need to educate, therefore, the young to be able to accept vaccination. And then the lifestyle that you are going to be adopting as a kid depends on how you see it in your parents. And again, as I said, therefore, cancer prevention should start at a young age. Not when we are teenagers, when we are going to get the first screening for breast cancer. Not this kind of mantra. And if we are in USD, we should be teaching our students to do that. It may be late because they're already in college, but the next generation of USC graduates who have been educated to tell their kids, to tell their families to get vaccines from the very beginning, eat a healthy diet, practice healthy lifestyles. We are going to be the change makers, because we are the ones who have a sustainable program to educate this country. We are one of the biggest universities in this country, and therefore we should play that role.
Yes.
ASEC is not here, pero DOH has health promotion section and department. And in terms of health prevention, they target different age groups. So it would really depend on what would be the target. For example, adolescents, they have the prevention for, well, in terms of improving lifestyle practices like the alcoholism, the drugs. For lactating and pregnant mothers, so we have different also activities. So I think in terms of DOH, they have health promotion in activity span across different life stages, yeah. So I think medyo kailangan lang natin maging familiar din in terms of what are the services, because a lot of people are talking about access, but sometimes we can access if we don't know the services. So siguro be mindful na lang rin of what services are available for us to utilize.
Yeah, I just want to add, no, and this is actually to encourage the youth who are present here, the students, no. So I always believe as a marketer, that the most effective form of marketing is actually word of mouth.
Chikahan.
So, yes, diba? So instead na magchismisan tayo about love life, why don't you talk to 5 people after this session about the learnings you learned today?
Yes,
so
please.
number 1, we need to solve the health access issues, and one of the things that we can do is to include that in the daily conversations that we have. So if you know somebody who's struggling financially and cannot actually provide medicine, then you offer something, the generics. If you know somebody who's has triggers for pneumonia and other cancers, maybe you can offer vaccination. And then if you are somebody who is into social media and you really just want to create change, why don't you use your talent to create videos, TikToks that you can share, where you can talk about the different options that we have on how we can actually prevent disease. Oo, kasi nowadays, sabi ko nga, ang ganda ng timing, no? Because all of you here are very fortunate because you have access to technology. Nung time ko, grabe nung na-stroke yung mommy ko, hindi ko alam kung paano ko aalamin because I'm not a doctor. I'm an accountancy student at that time. Sabi ko, paano ko ba maintindihan yung disease niya? But right now, in the power of your hands,
information is accessible for everyone.
So you can be
yes.
praning, okay, how praning you can be. If you don't have money right now to do your annual physical checkup, just check, Google every symptoms that you have. Okay, why am I
Parang ako yun.
experiencing like
Parang ako
this? Severe headache. Okay, migraine na pala siya, tapos paulit-ulit.
Right.
Bakit ayoko ng sunlight?
You know, I think the key takeaway is to be an advocate for yourself when it comes to health and wellness. And if you're like that, you could actually spread the word not just to your friends but also to your family, di ba? Kasi ang hirap nang you don't know what's happening, but you have the platform, you have the voice to advocate for health, not just for yourself but also for your loved ones.
And that is actually sustainability.
That exactly is sustainability. Napaka-Miss Universe ng answer ni Miss Lucinda. But that's true, right? Now, any final words? Were we able to answer the question? Do you have any follow-up question, Justin?
Wala na po.
Wala naman. So, okay, approve. Raise a thumbs up. Thumbs up. So, Miss Belinda. All right. 2 hands pa. All right. Thank you so much, Justin. And I think that wraps up our question and answer portion. If you have any other questions, baka later in the afternoon session, you could ask around our panelists. All right, let's give a round of applause, please, to our esteemed speakers and guests. Thank you once again for our distinguished panel of speakers. Now, before we officially close, let us take this opportunity to capture this meaningful moment with a quick photo op. Now, can we all stand up, please, panelists? Kasi tatanggalin na ulit natin ang ating sala dahil tapos na ang chikahan portion. All right. May we please call back, may we please stay, and to our esteemed UST friends, can we please step aside first? We will have first a quick photo op. Can I call on back on stage our Manila Bulletin executives? We have the head of Manila Bulletin Brand and Marketing, Mr. Leslie Araujo, joining them. We also want to call back on stage Mr. Irish Lorenzo, Mr. Ray Ilagan to join the quick photo op. We could also include the Manila Bulletin Publisher Secretary Herminio Sonny Coloma Jr. Please come up here on stage. Alright, sasama yung ating UST team later. For now, we have the brands and the Manila Bulletin executives. All right, quick photo op. Smile. All right, now when we call back on stage Miss Diane and Miss Ivy of UST to please join our panelists. Sorry naman, umupo pa kayo. Exercise daw, ayan. All right. Another photo op. All right, thank you all so much. Another round of applause, please, everyone. Everyone, you may now go back to your seats. All right. Now, this is the most exciting part I know all of you are looking forward to. We are now gonna announce the raffle winners for this morning's session. Lahat ba nakapag-register? Lahat ba sumagot sa survey form? Okay, bear with me because we have 51 winners. Kaya ko to, guys. All right. Ayan na nga ba sinasabi ko na mga dietitians, mga tourism students. All right. Now, the winners for the Watson's Pink Box worth 600 pesos. May I call on John Patrick Lim and Zia Patron. Now, for the Watson's Blue Box worth 1,000 pesos, we have Kelly Capule, Mikaela Ngo, John Brunel A. de la Cruz. Gusto ko yung meron pang initial, middle initial, A. Alright, next, for the Watson's Yellow Box worth 600 pesos, ito medyo big box to. We have 4 winners. We have Syra Joy Azusana, Renee Angela C. Lacayanga, tama ba? Lacayanga, Mary Kirsten Offren, and Jasmine Lian R. Acantilado. Congratulations. Next, wait lang, 3 pages to, guys. Next, for the Watson's Yellow Box small box worth 600 pesos, we have Luis Caril Orata. Ooh, may audience participation kay Luis. Next, we also have for the AC Health gift certificates, we have 12 winners. Congratulations to Fomela Nicole Luby. Yes! Gusto ko yung yes! Alright. Aisha Gwen Montalan, Nero Ronel, tama ba? Ranuel, T. Pasha, John Joshua Lee, Jethro Mackenzie Sia, Mary Joy Carmen Weich. Wow, may tili. Jose Vester Casano, Gabriel Giab Liwi Cortez. Ay, ang daming fans ni Gabriel. Liwi Cortez, Raven Andrew Enriquez, Sofia Pupos, Kent Alvin Velez. Congratulations. But wait, there's more. We also have the AC Health Umbrella winners. There are 12 winners. Okay, congratulations to Yanshi Rain Dakara, David Raniel Moraga, Becky Saus, Sofia Joy Bolias, Ann Goyena, Craig Darwin Vidad, Zaina Samantha Lim, Venice Ann Salaviera, Rose Ann Lacao Pesigan. We have Zaini Aryan M. Mercado, Yan Jermaine Sierra Salvania, Alisa Gilio. All right. Next, last page. For the AC Health Notebook winners, we have 12 winners. Congratulations to Ryle Zamudio, Felis de Dios, Ricey Jorlene Kiat, Louis J. Francisco Jr., Mirella Catharina Hernandez, Chloe Rayan Lim, Terrence A. Detera III, Thaddeus Michael Villanueva, Precious Samantha Lopez, April Joraine Peralta, Zaira Centeno, and James Patrick D. Garduque. Ay, iba yung fans ni James. Congratulations, you guys have notebooks. So, kailangan nyo mag-take notes. Sorry, hindi kayo pwede hindi mag-take notes. And our last set of winners, we have TMC Grocery winners. We have Sofia Ingrid Bernabe. Congratulations, Sophia. We have Rochelle Ann Gregorio and Kim Dorothy Dayag. And our last 2 winners will receive a Maxi Care Lifesaver Health Card. Sana pala nag-register din ako, no? Alright. Congratulations to Juliana Lane Lagula and to Lorraine O. Munoz. Now, all you need to do, to all the winners, make sure meron kayong valid ID. Suot nyo ba ang ID nyo? Can I see? May ID ba kayo? Alright. All you have to do is show your ID and present it to the table there. You can claim your prize there after the program. Alright. A round of applause, please, to all the winners. Congratulations. and thank you so much to our sponsors. All right, once again, that concludes our morning session of the 2025 Manila Bulletin Sustainability Focus Session themed Envisioning the Future of Healthcare. Once again, my name is Jackie Go, your host for this morning's MB Sustainability Focus Session. Now, for the afternoon session, my colleague Aziza Mondonedo will be taking over as your host. Mamimiss ko yung energy nyo, guys. All right, we hope that you have the insight shared this morning and it has sparked new ideas and conversations on how you can contribute because you guys are the future. So makipagchikahan kayo pero talk about healthcare, okay? For now, it's time to take a well-deserved lunch break. Yay! But please be back before 1 o'clock so that we can continue our afternoon session. Once again, my name is Jackie Go. Thank you and enjoy the rest of the afternoon. Bye!